Hello friends, let's discuss a very vital topic, experimental or the interventional studies. So what are the study types under the experimental studies? Randomized control trial, field trial, community trial and clinical trial, okay? So under RCT, what is the subject? Patient. Under field trial, it will be the healthy people. Under community trial, the community, and the clinical trial, the patients. So randomized control trial, what is random? Equal and known chance. What is controlled? Comparison group. Trial we do for a new drug. So we have a new drug M. M is an antipyretic. So we want to test M's ability to reduce fever. Its antipyretic ability. Okay. So what we do is that we select 200 patients from the OPD. Patients here means those who have fever. And we divide them into two groups. Group A 100 patients. Group B 100 patients. To group A we give the tablet M. To group B, we don't give the tablet M. So intervention given to group A, not given to group B. Done? So group 1 is the experimental group because you are giving the tablet, and group 2 is the reference group because you are not giving the tablet. So tablet M given to group 1, not given to group 2. Okay. So what we find is that in case of group 1, in 70% of the patients, the fever reduces. They are given the tablet. In case of group 2 also, 70% of the patients fever reduces. We have not given the tablet, which means what? 70% of the patients fever, it recovers spontaneously. That's the importance of a control group, okay, or a comparison group. Because if you are not using the control of the comparison group, you would have come to a wrong conclusion that yes, drug M is a potent antipyretic and has a very good temperature reducing ability, yes or no? So if the comparison group is not used, then we come to a wrong conclusion that M is a very good antipyretic. Now what can be the problem in this study? So what is the demerit? See, group 2 you have not given the medicine. Group 2 you have not given the medicine, that is the antipyretic M. So the group 2 people may feel, okay, the investigator is giving the medicine to group 1, not giving us, means he's cheating us, right? So when they go back home, suppose 30% out of those 100 in group 2 take paracetamol. So they feel investigator is cheating them. So they take medication on their own and their fever comes down. So next day when the comparison is done between the two groups, your investigator gets a wrong result, yes or no? This is called subject bias. So if they ask you this question in your exam, that what is the biggest demerit of RCT? What is the answer? Subject bias. And because subject bias is a type of behavior alteration among the group 2, so we can say subject bias is a type of Hawthorne bias, yes or no? Hawthorne bias, study subjects alter their behavior on their own. They felt investigator was cheating them, so they have taken paracetamol on their own. Got my point? So how to reduce subject bias in RCT? It's a very important question. So what you do is that you use a placebo, okay? A placebo means a dummy tablet which will resemble M in size and color, but actually does not have the drug. Got my point? So investigators should give the placebo in the second group. Placebo means what? It's a fake or dummy tablet. It should resemble in color and diameter, resemble M in color and diameter. So now the patients in the reference group do not feel cheated and they do not consume paracetamol at home. Okay? So placebo is example of what? It's an example of single blinding. Why single blinding? Because the study subject is not aware of the treatment being given to him or her. Got my point? So I repeat, placebo is the way to reduce subject bias in RCT. What is placebo? Single blinding. Now coming to preclinical trials. So before the trial of a new drug is done in humans, they should be done in animals, and this is called a preclinical trial. Okay. Now what can be the problem here? See, suppose during a preclinical trial, the investigator comes to know that this drug M, this antipyretic works only in case of high grade fever. So what he does is now, when he will do this particular randomized control trial among humans, so in group 1 where he will give the drug M, he will select patients those who are having very high fever. Okay. So during RCT, more high grade fever is taken in the first group and deliberately low grade fever is taken in the second group. So obviously now results will come in the favor of M. Yes or no? Because in preclinical trials, he has come to know that M works only in case of high grade fever, right? So now results will show what? M is better than paracetamol. And what is this called? This is called selection bias. You have deliberately selected high grade fever in group 1, low grade fever in group 2. So how to eliminate selection bias? How to eliminate the selection bias in randomized control trial? This can be done by randomization. What is the meaning of the word randomization? Equal distribution. That is, all the high grade fever will be equally distributed in both the age groups, okay? In both the groups. All the low grade fever will also be equally distributed in both the groups, okay? So this is similar to what? Matching. Matching in confounding factors. Matching of the confounding factors, yes or no? So it will ensure what? It will ensure the comparability of both the group. Both known and unknown confounding factors are equally distributed. So ultimately, confounding can be removed by matching, bias can be removed by blinding. But why is randomization best technique? Because it can remove both confounding and bias, right? Randomization, very important point, it's the best because it can remove both confounding and bias. That is why randomization is called heart of a trial, okay? It's the heart of a trial. It's the best trial. And what is a clinical trial? Clinical trial is what? Clinical trial is regarding the efficacy of the drug, okay? The side effects of the drug. So clinical trial usually has 4 phases. What is the first phase? It is done on the healthy human volunteers. So what we do in the first phase? We try to evaluate the safety and the non-toxicity of the drug, okay? Evaluate the safety and the non-toxicity. Now if they ask you this question, which phase of the clinical trial is done on patients? Answer is phase 2, where we want to know the efficiency of the drug, okay? So phase 2 is done on patients to test for the efficacy. Now phase 3 is called the comparison phase, where you are trying to compare with an existing drug already present in the market, okay? So phase 3 means comparison trial with an existing drug in the market, and phase 4 is for long term and the lesser known side effects, okay? So look at this question. Post-marketing surveillance is done in which phase of a trial? Obviously, post-marketing surveillance will be after you have compared with the existing drug in the market, okay, and launched it, okay. So it's for the long term and the rare side effects. So it is done in the phase 4 of a trial. Next question. Which is the longest phase of the trial? Longest phase. Longest phase is the comparison trial with an existing drug already existing in the market, okay. So this will be what? Phase 3. As you know, you can see that phase 3 is on patients. It's a comparison trial with existing drug in the market. Look at this question. Maximum failure of drug is seen in which phase? Maximum failure of drug is seen in that particular phase where you test the efficiency of the drug. That is phase 2. Okay. Look at this question. Most superior study design in epidemiology. Yes, the answer will be meta-analysis. So what is the meta-analysis? It's the analysis of multiple studies together, okay? Thank you.